Can you save your pregnant patient? These are OB emergencies you have to know based on presentation. So I'm going to give you the presentation and you're going to tell me what the OB emergency is. All right. So we have 1, 2, 3, 4, 5 of these that we're going to go through. These are your top 5 OB emergencies. All right, here we go. Your patient has severe abdominal pain, rigid abdomen, and vaginal bleeding. What does this patient have? That is a placental abruption. That is a very big deal, very big OB emergency. All right, let's see if you get the next one. Patient has a headache, hypertension, and proteinuria. What is this in your pregnant patient? That is preeclampsia. That one's really dangerous because it can progress to eclampsia. All right. Next one is unilateral pelvic pain and shoulder pain. Now, this is a big one and students miss this a lot. Anytime there's shoulder pain in a woman, we get nervous. Okay. I'll tell you why in a minute after you answer this one. All right. Unilateral pelvic pain and shoulder pain is an ectopic pregnancy. So anytime there's shoulder pain in a woman, this is just a pearl of wisdom for the NCLEX and for exams. Shoulder pain in a woman could either be a sign of an MI, that is a female MI, they will complain of shoulder pain, not necessarily chest pain. Number 2, it could be ectopic pregnancy, which we just saw here. Number 3, it could be gallbladder disease, which again requires some emergency care. All right. All right. Next one, sudden shortness of breath and chest pain postpartum. This is a big one that you have got to recognize. What does your patient have? This is an amniotic fluid embolism. This one can be fatal if you do not move quickly. And even if you do move quickly, sometimes it doesn't end up good for the patient. So you do have to recognize this. All right, last one is a pregnant patient has a seizure. What is this emergency? That is eclampsia. All right. Do you know your OB emergencies? How many of these did you get right? Let me know in the comments. And I have an entire playlist of emergencies on each body system if you want to check that out to make sure that you're ready for your exams and for NCLEX.